Inhalants, glue sniffing, volatile substance abuse, inhalant-related disorders. Inhalant drugs, volatile substances, are widely available and frequently abused, especially by adolescents from a poor socioeconomic background. These substances are mostly volatile hydrocarbons that are used as a solvent, propellant, thinner, and fuels. The hydrocarbon is typically inhaled by pouring into a container for sniffing, a rag or sock for huffing, or a plastic bag for bagging. Abusers often begin with a sniffing, low concentration, and progress subsequently to huffing and bagging, higher level of exposure. The most commonly abused inhalant include toluene from paints and gum, glues, toluene, butane from cigarette, petrol, butane from cigarette, lighter fluid, butyl and isobutyl nitrite, halogenated hydrocarbon from typewriter correction fluid, propellant and dry cleaning fluid. Inhalation of volatile substances producing intoxicating effects rapidly. They are well absorbed through the lungs and distributed quickly to the CNS. One or two huffs will begin to intoxicate the user within seconds, and the effect usually lasts for several hours. Chronic users can maintain a prolonged high with periodic inhalation very few hours. Adverse effect, toxic effect, acute CNS excitation, agitation, hallucination, headache, vertigo, nystagmus, ataxia, convulsion, lethargy, stupor, respiratory depression, severe sudden sniffing death syndrome. Inhaling butane gas can cause drowsiness, narcosis, asphyxia, cardiac arrhythmia. Butane is among the most commonly misused volatile solvent. When it is sprayed directly into the throat, jet of fluid can cool rapidly to minus 20 degrees Celsius by adiabatic expansion and laryngospasm, causing sudden sniffing death syndrome. Some inhalants can also indirectly cause a sudden death by cardiac arrest in a syndrome known as sudden sniffing death. Sudden sniffing death. The anesthetic gas present in the inhalant appear to sensitize the user to adrenaline, and in this state, a sudden surge of adrenaline from a frightening hallucination or in run with aggress may cause fatal cardiac arrhythmia. Furthermore, the inhalation of any gas that is capable of displacing oxygen in the lungs, especially gases heavier than oxygen, carry the risk of hypoxia as a result of very mechanism by which breathing is triggered. Since reflective breathing is prompted by elevated carbon dioxide rather since reflexive breathing is prompted by elevated carbon dioxide levels rather than diminished oxygen level. Breathing a concentrated, relatively inert gas such as computer duster, tetrafluoroethane, or nitric oxide that removes carbon dioxide from the blood without replacing it with oxygen will produce no outward signs of suffocation, even when the brain is experiencing hypoxia. Once full symptoms of hypoxia appear, it may be too late to breathe without assistance, especially if the gas is heavy enough to lodge in the lungs for an extended period. Even completely inert gas such as argon can have this effect if oxygen is largely excluded. Other effect, methemoglobinemia, butyl and isobutyl nitrite, carbon monoxide poisoning, methylene chloride, hepatitis, chlorinated hydrocarbon, metabolic acidosis, rhabdomyolysis, renal failure, hypokalemia, toluene. Chronic painter syndrome, a neurobehavioral syndrome due to solvent-induced encephalopathy, characterized by memory loss, anxiety, depression, sleep disorders, neurasthenia, personality changes. CT scan often reveals areas of atrophy, and EEG reading are usually abnormal. Cerebellar dysfunction with a chorea petrol, peripheral neuropathy and hexane, increased incidence of leukemia, plastic anemia, and multiple myeloma, benzene. Abdominal pain, nausea, vomiting, hematemesis, cardiomyopathy, hepatotoxicity, pulmonary disorders, pulmonary hypertension, acute respiratory distress, dementia, leaded petrol toluene. Main effect following chronic toluene abuses are renal tubular cirrhosis, resulting in hypokalemia and muscle weakness. The chronic toluene exposure characterized and induced cerebellar ataxia, tremor, and nystagmus, titubation, pyramidal signs, and cranial nerve damage, particularly hyposmia, optical atrophy, have been reported. Cerebellar and cortical atrophy may also seen as a computerized tomography. Muscular weakness presenting as a cautery paralysis may be found and life-threatening and may mimic the Guillain-Barré syndrome. Such a patients usually have associated severe metabolic disturbance, including hypokalemia. Cognitive functions may have also depressed and dementia may have been observed. In less severe cases, school or work performance may be impaired because of apathy and poor concentration. Toluene also caused asymmetrical peripheral neuropathy, optic atrophy, and hearing impairment have also been reported. Inhalant intoxication like alcohol intoxication usually requires no special treatment, resolves spontaneously. However, complications such as cardiac arrhythmia, bronchospasm, coma, etc. will require prompt treatment. Essentially, medical care primarily involves reassurance, quiet environment, attention to vital signs, and a level of consciousness. Sedative drugs such as benzodiazepine are contraindicated since they may aggravate intoxication. Severe agitation may require cautious control with the haloperidol 5 milligram for adult intramuscularly, repeated only once after 20 minutes if necessary. Treat pulmonary edema or acute lung injury with a continuous positive airway pressure, or in severe cases with IPPV and PEP. Inhalant dependence requires special treatment by a qualified psychiatrist. May take 3 to 12 months for achieving total abstinence, as lapses are not uncommon. Medical, social, and forensic issues. Volatile substance abuse is a uniquely adolescent phenomenon and is particularly common among lower socioeconomic classes, mainly because these substances are cheap, easily available, and legal to possess. Also, the mode of intake is relatively simple. Volatile substance is quite common among street urchins of major Indian cities, probably because this is inexpensive substance offer a rare, exciting experience to escape from the daily misery of poverty. Persons with adolescent conduct disorder and adolescent antisocial personality disorder especially prone to this volatile substance abuse. Most widely used inhalant Dendrite brand and other forms of contact adhesives, rubber cement manufactured in Kolkata, toluenes in a paint thinners. Another very common inhalant is erase XA correction fluid that contains toluene. It has gone very common for school and college students to use it because it is easily available in stationary states in shops in India. This fluid is also used by street and working children in Delhi. Thank you.